been about flushes or sweats or, oh, she's a bit hormonal, let's just ignore her. But actually, we know the commonest symptoms that affect people are the memory problems, the fatigue, the anxiety, the low mood, the brain fog. And that's what hasn't been addressed by healthcare professionals, by people in the workplace, by women themselves. We often don't recognise those symptoms as being related to our hormones. So I think this is a way where people are actually, it is real what's happening out there. It's really affecting women's ability to work.
Yeah. As well, we covered yesterday about the menopause actually being described as a disability. Would you agree with that?
It's really difficult, isn't it? But if you look at how you define disability, it's either a longer term, either psychological or physical impairment. Now, I've seen thousands of menopausal and perimenopausal women, and a lot of them would have disabilities.
Yeah.
You know, I visited one of my patients recently in a psychiatric hospital.
No.
She stopped her HRT because of the HRT shortage. You know, it has a massive effect on some people's brains, you know. And so we have to realise that it's not just this transition that we go through in life, and giving us time off work isn't always the best thing we want to do. You know, we know it's related to our hormones. We know there's evidence-based treatment. Why is it that only the minority of women are receiving that treatment?
So is what you're saying then, if the treatment is there and you get it right, you get the right amount that works for you, all of this whole conversation really goes away?
A lot of it will go away, absolutely. I sort of, bear with me, but I sort of think it's a bit like a broken arm. If I had a broken arm and went to work, I'm hoping if you were my colleagues, you'd say, Louise, that looks a bit painful. Let's take you to the nearest A&E, get it sorted, have a bit of time off work, and we'll adjust while your arm's improving. The menopause, again, has treatment. And so we should be talking about it in the workplace, recognising it in our colleagues, because that can really help. But then saying, let's help you find some treatment. And HRT isn't going to help every symptom, of course, because it's not all related to just the hormones. We've got to look at lifestyle, nutrition, everything else. But without hormones, how can you get your brain to work properly if your symptoms are due to the low hormones?
You say talk to colleagues and, you know, talk to your employers. But how would somebody go about approaching to do that? Because, you know, it's quite a difficult subject.
It is.
And you don't want to be stigmatised as, like, I can't do my job.
No, but absolutely. Yeah. But people don't use it as an excuse for not doing their job. They actually often want help. And I know myself, I see more of my work colleagues than I do of my husband. You know, you're at work a lot. And even 7 years ago, when I was experiencing symptoms and really couldn't remember a lot of things, really struggling with my job, I thought it was because of stress. But actually, if someone had come into my room and said, Louise, you're not quite yourself, you know, you're not quite sparky, is everything okay? Have you read this leaflet? Could it be related to your hormones? Age 45, I would have been delighted for someone to have said, there's certain ways of doing it.
There are some people that won't be delighted to hear that, though.
No, but I think...
It feels like
I think it's also, yeah, but there's this taboo as to what the menopause is, isn't it? And I think there's a lot of people also, because it affects every woman, it's almost like, well, we've just got to get through it because our mothers did or our sisters are or whatever. But actually, when you realise that it's not just something that can cause symptoms, but it also increases the risk of diseases. You know, this month, as you know, is World Menopause Month. They're focusing on cardiovascular disease. Heart disease kills more women than all cancers combined. Taking HRT halves the risk of heart disease. We've got to be thinking in a really grown-up but joined-up way as to, you know, what are the risks of not having hormones? And there are quite a lot of risks in the workplace. Around 10% of women give up their jobs because of their symptoms.
And that's just not on. And that is also something, like, as you just said, could be avoidable, potentially.
Yes, absolutely. Definitely.
And what can we do then so if somebody's come to us and said, look, I think I'm having symptoms or...
The most important thing is for people to get information. So, you know, download the Balance app, go onto websites, have a look. And then I feel very strongly that women can choose what they want to do. So if they want to take hormones, absolutely they should, because we know the benefits outweigh the risks for most women. But look at how you can modify your life, improve it. You know, most of us are menopausal for decades. So we need to invest in our future health now so we reduce our risk of diseases as well. But knowledge is power and choice is really important as well.
You estimate that as many as 4 million workdays are lost in the UK every year due to menopausal symptoms. So this is having a massive impact on an awful lot of things.
It's a huge amount. We did a survey recently of NHS employees, and 37% are thinking about reducing their hours but can't afford to. We know around 10% give up their jobs. We know that a lot of people are taking longer-term sick. So a study we did showed at least 8 weeks of time is quite common for people to take off. Yet they're being signed off with anxiety, depression. And actually, if we address the underlying cause, a lot more people would not only stay in work, but they'll get promoted. There's a lot of talk about flexible working or working from home. Well, that's not not acceptable for a lot of people. And I don't want to reduce my hours as a menopausal woman and reduce my pay. We shouldn't be forced to doing that when we've got an evidence-based treatment that's available.
So we need to wake people up, don't we? We need to wake people up with the symptoms of menopause, because sometimes you wouldn't even know that you're even going through the menopause, because it can hit very early on now.
Absolutely. And perimenopause can affect people in their 20s and 30s. And so I think what is happening, what these cases are showing, is that the women are waking up, maybe quicker than others. But that's really important when it's happening to our bodies.
And also, the other thing is, we can talk about this, you can be aware of the symptoms, and then, try and get an appointment with your GP. Once you get there, you say about this, and then you meet a brick wall. Like, it's not that easy to get HRT.
Yeah, it's getting easier. Education is improving. We've just relaunched our education programme that's available, actually, not just for healthcare professionals, but for people as well. Anybody can get the same information. And actually, as a doctor, when I have patients that are more empowered with information, it makes the consultation so much easier as well. So we need to just keep being persistent as patients to get the right help.
And what are the government doing now to make sure employers and employees and colleagues are aware of this?
They're looking at how to improve education, how to improve awareness, which is the first step. But the next step has to be, what are we going to do about it? We can't keep talking about it and knowing that so many women are suffering.
And do you feel like people are more open to this now? The more this conversation goes on, the more we keep...
I think so, because because women know it's affecting them. So I think there's more of a grassroots than ever there was before, because women are helping each other. We're good at talking. We're good at sharing.
I think more people talk about it. I mean,
well.
with Davina and everything, she was doing, you do feel like people talk about it more. I do feel like the dial has shifted. It's still got a long way to go, I get that, but it does feel like it's
it is. I mean, I'm actually going to Australia tonight to talk at a big conference about mental health. I'm going to be talking about mental health and hormones.
Yeah.
Last night I was talking to a psychiatrist who's done a lot of mental health work with women. So we're looking at it in a different way. We're not looking at it just causing a few hot flushes, maybe the odd mood change. And that's going to make a big difference as well. Yeah.
Well, safe travels. We'll see you when you get back.
Yeah, have a good time. Yeah. And we are waking up, which is a real good thing. Yeah, we talk about it now. And,
we do.
Yeah. Right, don't go anywhere, as in just a moment we've got an exclusive interview with Caitlyn Jenner, where she'll be discussing everything from the Kardashian empire to life with 22 grandchildren. And
ahead of Big Brother's return this weekend, we'll be catching up with 3 legendary housemates: Grace, Mikey, Chantel, Josie Gibson. They're all going to be joining us live on the sofa to update us on what they're doing now and taking a look back at their Big Brother highlights.
Easing into mornings. Ninja Foodie Stay Sharp